Thank you, everybody, for joining us today. To kick us off, I'd like to introduce our IHRSA President and CEO, Liz Clark, and then we'll get into the issues and what we're watching at the state and federal level this year. Liz?
Yeah. Hey, thanks, Mike, so much. Thanks for everybody for being here today and for pulling this together, Mike and Charles. Yeah, listen, I mean, I just want to welcome everybody for being here and say how thrilled I am to be able to be sharing this presentation with you and to see how far we've come, in such a short time as an organization. I think those of you that are on this call, and I know most of you from the names, understand that this organization, has really been in a transition to pivot to be away from a meetings and events organization to an advocacy and communication event or organization. It's not to say that we're not going to have a fantastic event in Los Angeles next month, but also we've really stepped up our game on advocacy with the addition of Mike and Charles. So we've had some wins, which are not easy to come by. And I think that probably we will get into that a little bit, and then an opportunity for you all to share questions and flag priorities for you and what you're seeing in your states and what you're seeing federally and ways that we can help. So thanks for having me, and back to you, Mike.
Great. Thanks, Liz. Really appreciate everybody joining today. Just a quick housekeeping item. We will be taking questions in the chat to make this easy. As it is being recorded, it'll simplify and allow us to answer any questions that you may have. So feel free throughout the webinar today to go ahead and place your questions in the chat, and we'll answer them at the end. We wanted to take you through what the goals of our organization are and what it looks like as we continue to build out our advocacy programming. As you all know, our advocacy program at IHRSA is evolving into a real powerhouse here in Washington, D.C. and throughout the state houses, with the goal of protecting and promoting the health and fitness industry, your businesses, and protecting the bottom line of operators throughout. This gives us the opportunity to not only reshape and reframe how the industry is viewed by policymakers, trying to really position us as a part of preventative healthcare rather than just a hobby, or as some may see it throughout the policymaking community, as just a business on their main street. This allows us to work with policymakers, work at the federal and state level to really earn the recognition of having a seat at the table and being able to share how this industry can help impact the physical and mental health of Americans throughout the country. We do this by forming a consensus on all policy opinions and positions that we engage on at the federal, state, and regulatory level. Through the National Health and Fitness Alliance Advisory Council, which is our main policy committee of IHRSA, it allows us to form a consensus from all spans of the industry, from boutique studio all the way up to large big box gyms, and to understand exactly how policies are going to impact the industry across the board, and allow us to really go in and have conversations with policymakers on the impacts of that policy and engagement, and give us the opportunity to help frame the narrative and share the story of the industry with those folks as they're considering changes in legislation or policy. We do this through a combination of a strong advocacy program, with Liz leading the helm as with the addition of myself, Jeff Soulsby, who is our senior director of senior vice president of communications, and the recent addition of Charles Rignante as our manager of government affairs. It gives us more than 50 years of Washington, D.C. advocacy experience. And also Charles brings a new depth of state advocacy coverage as well, that will allow us to really engage at all levels of government and make meaningful advances in policy. We also have some external resources. We have a well-connected lobbyist firm here in Washington, D.C. by the name of IHRSA Government Affairs, with strong ties to parties on both sides of the aisle and legislators currently in office, that helps us not only get our foot in the door, but really helps make those connections and make strong, lasting relationships with lawmakers on Capitol Hill. We also look and monitor legislation and regulation across all 50 states, and then engage strong individual state lobbyists when needed to come in and really help us make our mark on policy and really get some work done if need be, and if it's above our reach and capabilities. In addition to that, we have a strong grassroots network. As we always like to say, we are only as strong as our membership, and your voice in the membership is so much more powerful when communicating with lawmakers at the federal and state level. And then, of course, we love to support those who support us. So with a well-equipped IHRSA Political Action Committee that's built on voluntary personal contributions from individuals in the industry, that equips us with the ability to say thank you to our champions here in Washington, D.C., that go above and beyond to support our policy goals and support the industry as a whole. So I'd like to start off our conversation today about our federal focus, talking about the legislation, the regulations, and the growing influence and positioning that we're building in coalitions here in town to really help make our mark. Starting with the legislative efforts in 2023, the FIT Act, as many of you know, was reintroduced in Congress with more support than ever before. We currently have bills in both the House and the Senate that are growing support by the day with lawmakers on both sides of the aisle. In the House of Representatives, we're hovering around 70 co-sponsors for the bill, but a majority of those co-sponsors are coming from key committees of jurisdiction, and it's key supporters that'll really have the ability to move the needle when we're pushing this legislation to be passed on the floor of the House of Representatives. In the Senate, we have some key voices. 20 senators in the U.S. Senate currently co-sponsor the bill, and that positions the legislation for great consideration prospects when the bill eventually ends up in the Senate as well. We're constantly pushing to get the bill not only to gain support from the men and women who are elected here in Washington, D.C., but also making sure that it is positioned appropriately to be considered by on the House floor and pushed for final passage. In Washington, D.C. these days, there's not many opportunities for pieces of legislation to move on their own. It's not the old episode of Schoolhouse Rock that we all remember when we're learning about the legislative process. In reality, most bills move in large packages, and the ability for bills to move really depends on their ability to hitch a ride on one of those vehicles. So we're staying engaged and utilizing our consultants here in town to make sure that we have a seat at the table and we're in front of all of those policy discussions to make sure that the FIT Act is consistently being considered and positioned to hitch a ride on one of those vehicles when the time is right. We're also focusing on the ways that the industry can help change the narrative and help really serve as a key resource in our military readiness and preparedness for the United States Armed Forces. Nearly 77% of the United States citizens are not, quote unquote, fit to serve, meaning that between their physical and mental health, they are precluded from serving in any of the armed service branches. And a large percentage of that, another 11 to 13%, is based on obesity and physical inactivity alone. So what we're doing is showing our vast network of physical activity options from, again, everything from those small independent studios all the way up to large gyms and facilities across the country, and talking to policymakers and the DoD and explaining how we can serve as a resource and utilization. We're working right now through the National Defense Authorization process, which will take place over the next couple of months for 2025 authorizations, to develop a pilot program that will focus on two key areas of the United States with large National Guard presence, to really be able to have a year-long training regimen for those individuals to do so, to stay healthy and stay ready to serve when they're called upon in their local communities. This is something when we have conversations up on Capitol Hill, lawmakers are extremely happy to engage with us on and hear about. And so we're trying to find the right path and hopeful that this year Congress will consider adding us as a resource in the Defense Reauthorization Act passage at the end of the year. There's also legislation that we're currently supporting in the House of Representatives, being introduced by a member of Congress named Scott Franklin from Florida, that will provide broad sweeping liability protections, not only for individuals that take the opportunity to utilize AEDs, right? Removing the risk of an individual in your facility grabbing the paddles when someone is having a life-threatening emergency, but also protecting the club or fitness facility themselves if the AED is used and unfortunately in circumstances not used appropriately or not successful in the operation of saving a life. So this bill has broad support, and we understand, and members of Congress are very supportive of breaking down any hurdles that may be in between one of your members or the facility itself having this life-saving equipment on site and the individual's willingness to utilize it. We're also working through the appropriations process to make sure that there's government-backed data on the size and scope of the industry. So therefore, as many of you may remember during COVID-19, we have some great jobs numbers and great size data to be able to show just how impactful the industry is at the federal level and all the way down to state and individual locations. So when there is, God forbid, ever an issue of who they are impacting with their policies, we have the number of jobs, number of locations, and and size of the economic impact on hand to be able to show lawmakers how important the industry is. IHRSA has really been stepping up our leadership of many industry coalitions, most importantly, the Physical Activity Alliance, which is a group of like-minded organizations who know the importance of physical activity for mental and physical health. And so with partners like the American Heart Association, the American Colleges of Sports Medicine, and others, we're really promoting a broad swath of legislation that will help promote physical activity, make sure it's a part of the healthcare conversation, and really change the narrative amongst the policymaker community that physical activity, again, is not just a hobby, but an essential part of physical and mental health, and making sure that in all legislative conversations around health in general, there is a component of physical activity and that it has a prominent spot in understanding its impact on American healthcare. With that, we'll turn the page over to talking about regulatory engagement. As I'm sure many of you heard, the Federal Trade Commission this year has been increasingly active in how you can operate your contractual agreements and membership agreements with your customers. Back in the beginning of the year in 2023, they rolled out a proposed rule on what they have dubbed click to cancel. And what this does is it really regulates how a member is able to terminate their agreement and providing, strict rules on the ability for an individual to go onto the website and alter or terminate their agreement with the click of a button. IHRSA has been engaged in this process with the Federal Trade Commission. We submitted detailed 15-page comments to the commission on how this will impact the industry. And we've been working throughout the process as they work to finalize the rule. The click to cancel rule is just one in many parts of the Joe Biden administration's work to really try and combat some of these consumer challenges that many of us have heard about over the years, whether that's with the airlines, the industry itself, and trying to get out of agreement, or any junk fee or issues that were, they're really trying to bring to highlight as ways of really helping the individual consumer across the country. As you'll see, the Federal Trade Commission has also recently introduced a new proposed regulation around quote unquote junk fees or requirements to force the industry to display the total price during any advertisement or any conversations with a consumer prior to their sign up. We're engaging in this junk fees rule because there's very little clarity in what is defined as total price. Does that take into account the total term of the membership? Does it take into account ancillary services such as spa treatments or personal training? Does it take into account, shakes or other purchases that can be possible in the members journey within your club or facility. So we're engaging. There's comment in developing comments that will go to the Federal Trade Commission on February 8th that will really share the impact that the proposed rule has on the industry and making sure that they understand how this could have unintended consequences or unintended impacts on the way that you do business. On the labor and employment side, we've been seeing a lot of movement from the Department of Labor. Recently, the Department of Labor has finalized its joint employer rule, which will really impact how a facility works with contractors, whether that's cleaners or other contracted services, or their personal trainers or other, relationships with outside independent contracting communities that you use other than full-time employees or part-time employees. What the law does is it really blurs the line as to when you can be considered an employer of that contractor's employees. These rules are really defined to help try and protect the employer of those contracts, but in a way that could increase liability on your facility and on your business when doing business with them. If you have individual control over when they're allowed to be in your facility, the uniforms or the way that they wear, or the overall scheduling of the employee's time, uh, those employees might be able to take employment law cases against your company as opposed to just their contracting company that they are a member of. So we've been engaged in this process through a tool that is allotted to the legislative branch called the Congressional Review Act. And we've had a recent success here with members of Congress and the House of Representatives voting to halt the Biden joint employer rule because of the negative impacts that it's going to have on small businesses and businesses that utilize these contractors on a heavy basis. That congressional review now goes over to the Senate for consideration, and we're hopeful that the Senate will vote to utilize the Congressional Review Act as well, halting this regulation before it goes into implementation. We've also seen the Labor Department release a new law on independent contracting that really rolls back any changes that were made during the Trump administration back to the Obama era independent contractor utilization law. So we'll be sending out soon a nice brief to help facilities understand exactly what that law entails and how you should consider your treatment with personal trainers and other independent contractors to ensure that your business is protected. Lastly, we've also seen the Department of Labor release a proposed change to the overtime exemption. What this does is it would raise the threshold of a full-time salaried employee to be considered eligible for overtime pay. That threshold currently is set at $33,000, and the Biden administration is looking to increase that up to nearly $56,000. This is important because for many who operate on a national basis, there is situations where a full-time employee, whether that be a general manager or the like, in one area of the country does not necessarily make enough to shoot over that overtime threshold, and then would allow that individual to be eligible for overtime pay of time and a half if they exceed 40 hours in a work week. So we're engaged with the administration as they and really focused on making sure that they understand the impacts on industries and on operators in the health and fitness industry while they're considering this work. Just a short save the date here. Our upcoming 2024 Flying and Advocacy Summit will take place May 7th and 8th in Washington, D.C. For those who haven't had the opportunity, IHRSA has had 2 successful fly-ins in 2023, bringing nearly 120 executives of the industry to meet with members of Congress on Capitol Hill. This is a great opportunity not only to learn about the issues, but to meet your representative, talk to members of Congress, explain your business, and really start to build that relationship with the people who make the policy changes here in Washington. It's also a great opportunity to network with industry executives and just have an overall great experience here in Washington, D.C., learning what we're doing to protect and promote the industry and helping us do so by sharing your voice along the way. With that, we'll turn over to state issues. As I mentioned earlier, our state program has for a long time been a very robust program that IHRSA has engaged in at the state level with legislatures, making sure that we're stopping harmful legislation before it can go in. And under our new core team here, we've been able to really focus and hone the tracking and identification of bills across all 50 states as they are introduced early on in the legislative process, engage where we can, but also identify areas where we need a little more juice and deploy on the ground state capitol lobbyists at a moment's notice to really help us move the needle and promote and protect the industry when need be. So with that, I'll turn it over to Charles, who's going to talk about some key issues that we've been monitoring and some key trends that we've been seeing and where we're focusing our time and attention in 2024. Charles?
Okay, thanks for the warm introduction, Mike. Everybody, there is a lot that's going on the federal side, which is being replicated by state legislatures across the country. First of which is click to cancel, right? And this is a issue where 18 bills were introduced across 6 states in 2023. This year, we're seeing 3 bills that were already introduced on this topic. And in certain states like Illinois, New York, and Massachusetts, these bills are already in legislature this year. And this is our top priority going forward. We were lucky enough last year with getting ahead of certain bills where we had a massive success in New Jersey with New Jersey Bill A3892, which required an online option for cancellation for health club services in the state of New Jersey. We were able to successfully amend the bill, providing that we clarified that cancellation means initiate termination. The amendment allowed for secured flexibility regarding cancellation methods and the location on the website. That really just made it, the ability to cancel to live in a member's portal rather than on the main landing page of the website. Part of the amendment allowed for cooling off. The cooling off period must be canceled through the initial location of the sign up of when where the consumer went to sign up for the contract. And then at the end, ample implementation time, right? This bill is now going to be implemented in the state of New Jersey in 90 days rather than immediately. Our win in New Jersey really serves as a model as we engage in legislation on click to cancel throughout the country in 2024, giving us a template for amendments to create a workable requirement.
Yeah, and Charles, if I may just jump in there, it's a testament to how an industry can engage with lawmakers in a really meaningful way. We were able to bring 2 clubs from New Jersey in front of lawmakers to describe how this bill would impact them before we altered it and before we were able to get the amendments and really share the real life impacts, but also show that we have a seat at the table and we want to work with lawmakers to make workable solutions to achieve a goal rather than just simply stopping bills in their tracks or complaining about their impact. So what we were able to do in New Jersey by introducing amendments to the process, and we were able to really craft a workable solution that, as Charles mentioned, we now can look at these bills that have already been introduced in 2024 and go to the lawmakers who are sponsoring them and say, listen, New Jersey has introduced a workable solution. How can we work with you so that it helps us change the perception of the industry, but also helps us change the reputation that we're simply not looking to be there to work with them on membership agreement and the like. So it's a great opportunity and a great win that we're able to carry through a lot of the work that we do moving forward.
Excuse me. So top policy trends for 2024, and I'm just going to go briefly across the next 4 issues here, but we're looking at price transparency and junk fees, which is, again, duplicative of what's going on the federal level. It's being replicated on the states. Cash acceptance type of legislation, which is essentially where we were seeing across the states a number of legislatures try to push bills that would require health clubs to essentially accept payment for tangible goods such as smoothies, merchandise, and so forth. So with that being said, there is a lot of different trends going on that are just affecting members. Liability waiver reform is bills across the country that are essentially saying that you are prohibited from having a liability waiver. There's sales tax bills, which are bills that are enacting sales tax on health club memberships, and AEDs, obviously, where there is enactment of bills requiring AEDs on for health clubs, and also different types of requirements of registering AEDs with departments. I'm just going to quickly talk about price transfer and cash acceptance and then move it over to Mike. We've been seeing a reflection of what's happening on the federal level with price transparency, specifically regarding bills that say that you have to include the total price in health club memberships, and also advertisements. And we're seeing that right now in the state of Virginia, with a bill that is requiring advertising to include total price. And this is kind of one of those bills where we are working with the sponsor, and we are, just like Mike said before, we are working with legislatures rather than rather than try to halt the bill entirely. We are trying to be partners in legislation. Moving on to cash acceptance. We're seeing in states like Florida, and we're seeing in states like Vermont, these types of bills where we are getting looped in to the retail business, or at least retail business or commercial establishment world, where it is, they're trying to, it makes sense. They're trying to allow more consumers to, buy services, those who don't have access to banking and so forth. But there's, that this is a massive issue for many health clubs who just don't accept cash. And that would be a huge administrative burden for a lot of our members. So, again, we are working with legislatures, and we've already had a little bit of a win in Florida, where we were able to work with a sponsor, amend the bill, and that amendment has passed through the first committee on the Senate side, which would exempt continuous service or membership based businesses. So these are some of the things that we're seeing on both of those topics, but I'll shoot it over to Mike to kind of discuss a little bit more about what we're looking about, what we're seeing in liability waiver reform, and our win last year in that topic.
Yeah, thanks, Charles. As many of you may remember, we've been seeing an uptick over the last year in attempts to remove the ability for the health and fitness industry to utilize liability waivers, and we're not seeing it slow down. The bill, we were lucky to have a great win last year in the state of Maryland when the industry engaged quickly towards the end of the legislative process, and we were able to stop a bill in its track that would remove that liability waiver ability, and really increase not only liability insurance threats from the club, but the influx of sue and settle cases from individuals who utilize the industry. This year, we're really paying attention to these bills early on and engaging early. We've currently already seen that Maryland bill reintroduced, but Charles and the team have been able to meet with the sponsors of that legislation, the chairman in the House and in the Senate in Maryland, and key lawmakers in the state, to get in early and see ways that we can amend the bill, like we did on the click to cancel bill in New Jersey, to make it workable and also protect the industry's utilization of these waivers. We've seen the bills also introduced in New Jersey. We saw liability waivers revoked in the state of Oregon, and there's efforts there to retroactively put it back in for the industry, which IHRSA will support the local state alliance in Oregon to help do so. But we're seeing this trend a lot, and it's something that we don't expect to slow down throughout states across the country. Moving on to sales tax, this is something that really allows us to proactively engage. There's currently 24 states in the United States that have sales tax on gym memberships and other services. And it gives us a great opportunity to talk to lawmakers and explain and really make our case that access to the industry increases physical and mental health and should not be made inaccessible due to increased costs. Sales tax on items like purchased goods versus sales tax on something you're utilizing for your health and wellness are not the same thing. So over the next year, we'll be engaging in these states, finding opportunities and finding bills that we can engage on to help maybe roll back and give that 6% back to the industry in those states, as opposed to it needing to be remitted to the state in sales tax. Additionally, on the proactive side, we'll be looking at ways to have the government help the utilization of defibrillators in the industry. This industry has a record for wanting to be as safe as possible. And there's certain states where there's AED requirements already, where clubs are forced to have them on site, and that doesn't come at a cheap cost. The purchase alone can range from $3,000 to $5,000 per individual piece of equipment, and then there's upkeep and additional charges throughout the lifespan of the equipment to make sure that it's in working order should there ever be an emergency. Uh, it's our goal to make these as readily available as possible so that we continue the safety standards that the industry is known for, and that this life-saving equipment is available if need be, no matter where you are in the country. But the industry is a largely built on small businesses, and having any assistance from the state and federal government in order to deploy and maintain that equipment is something that we're looking at, and we're hopeful that we can make some headway in this year. Moving on to ways that you can get engaged with IHRSA and how we can stay informed and stay up to date. I saw that there is a note in the chat on a running list. We're in the process of finalizing the IHRSA Action Center, which will give you access to a running list at any time of all of the bills that we're monitoring at the state and federal level. With this tool, you'll be able to drill down by issue area, drill down by state specifically, or drill down from the federal and large batches of states that you're interested in to see everything that we're monitoring, from the topics that we discussed today to other topics that we are keeping an eye on so that you don't have to. We'll put in the chat, there's links to sign up to receive not only our monthly advocacy wrap up, but all of our government affairs issue alerts that we'll put out on these bills in the coming weeks and months. Over this year, you can expect to see a lot from us in your inbox. We will be sending out individual updates on all of the bills that will include not only the information that you need to know about how the potential bill will impact the industry and your company, but also ways that you can engage, whether that's through a one-click campaign to message the elected officials, or to sign on to letters that we are sending in support or opposition to those issues as well. Lastly, we are going to be increasing some advocacy programming at the upcoming IHRSA 24 convention and trade show. So there'll be some key issues that we're diving into to really inform you at ways that these issues are impacting the industry, and to make sure that you're aware with all the tools and resources that IHRSA has available for you to not only comply, but stay informed on these issues moving forward. We asked everyone to join our grassroots army known as Team 435. This is a great opportunity to stay engaged at a different level through, again, as I mentioned, those one-click campaigns. They are really our identified fitness facilities in all 435 congressional districts that are willing to step up and click that link when we send it out, so that members of Congress are hearing from you on the issues that are important to the industry. As I started the conversation with early on, there is not much better advocacy tool that we have as an association than our members' voices. When you reach out and touch base with an elected official, it gives them a direct link to a constituent in their district that their decisions will impact, and certainly helps for you to be engaged. Also, engage on social media. Your network is much larger than ours. You have friends in the industry that aren't necessarily always a part of the IHRSA communications. And the more that you talk about the work that we're doing and where we need help from the industry to engage, the more the message gets sent and the more that we continue to speak with a unified voice on behalf of the industry. Lastly, there's opportunities to support our efforts by attending the upcoming fly-in, as I mentioned, hosting the elected officials at your facility. It's a great opportunity, and we have resources to help you do so. Having that member of Congress come to you in the community, meet with your members, see the businesses that you operate, certainly helps them paint the picture and see not only the gym or the fitness facility as they may experience it as a consumer, but understanding what goes on behind the scenes to run the facility and really what goes into the business decisions that you all make in your day-to-day operations. Lastly, feel free to contact us to learn more about the IHRSA PAC. As I mentioned, it's one of the greatest tools that we have in our arsenal to be able to thank those who support us. It's built entirely off voluntary contributions of personal finances to the IHRSA PAC, and that money is spent specifically to say thank you to lawmakers that support the industry and support the work that we're doing to make sure that we're protecting and promoting it. With that, we'll open the chat up for any questions. Our contact information is on the site, but if there's ever anything that we can do from you from the advocacy side or to answer any questions about IHRSA and our programming overall, our contact information is there to reach out. One quick link is there, a question in the chat is there a list of more important sponsors of the FIT Act? I solicited 2 congressmen and I'm working on 2 others. Yes, I'm happy to engage, and we appreciate the engagement on our key piece of legislation that will expand HSA and FSA eligibility for gym memberships. Right now, it's all hands on deck. On our website, you'll be able to see who is on the IHRSA Action Center, as I mentioned, which we'll send out in a follow-up email afterwards, driving you with all of the links that you could see. You'll be able to see who is currently co-sponsors of the bill. And right now, the name of the game is really getting as many supporters as possible. As I mentioned earlier, given the scenario of how hard it is to move legislation these days and get it across the finish line, needing to find that vehicle, the more support we have from bipartisan members of Congress on a piece of legislation, the easier the case is to make for that bill to be attached as an add-on to any vehicle moving. So all non co-sponsors in the current time frame are the most important people that we can be reaching out to and converting to supporters of this common sense piece of legislation. With that, I will just mention again, I would like to thank everybody for jumping on. We will be sending out again a detailed follow-up, including the recording of this, but also ways for you to engage. We'll link to our Action Center to see all of the legislative bills that we're tracking across all 50 states and at the federal level, and ways to engage through our one-click campaigns and Team 435. I thank you all for joining us today and look forward to continuing to communicate with you on all of the advocacy advancements that we're paying attention to over the next year and beyond. Thank you.
Mike, I think Jeremy may have a question in the chat.
Oh, thanks. Yes, Jeremy, we will be sending out the link to the Action Center, as I mentioned.
Yeah.
With the full running list of all of the bills, and you'll be able to click divide by state and divide by issue. Thank you.